Welcome, everyone, to Navigating Payor Audits. I'm Deb Silverman, the head of our managed care group at Garfunkel Wild, and I'm here with Rob Del Giorno, the chair of our compliance department, and Simon Chaykler. Simon works at Garfunkel Health Advisors, our affiliated consulting company, and Simon is a certified coder and often advises clients dealing with these types of audits. I focus primarily on commercial payer audits, and Rob, who's our expert in Medicare and Medicaid, handles governmental audits. First, a bit of housekeeping. This session is pre-recorded, so unfortunately, we are not able to answer your questions in real time, but we will be back on at 3:30. So if you have any questions, type them into the chat box and we'll respond to them at the later afternoon session. So let's get started. Rob?
Yep, and I'm excited to be here because navigating these audits, they've been coming faster and with a lot more consequences now, especially in the Medicare, Medicaid government side of things. They're not being limited to coming in, identifying payment errors, and recouping money. They are digging in, they're data mining, they're looking for fraud, waste, and abuse, and then they're going out and exercising additional enforcement tools they have, such as revoking your Medicare privileges, which of course will trigger being kicked out of Medicaid as well. So there are some really important things you need to be aware of happening in this space, and getting started by getting your house in order before being audited is a great place to start. So before you're being audited, here are some things that you need to do. When you walk away today, go to your office and make sure you have a system in place to ensure that notifications are not missed and that they're being sent to the right people. Identify specific personnel that need to be aware of and involved in the audit process. Define the roles and instruct them on reporting within your organization. They should not be turning over any records without approval of the appropriate supervisor. How many times I've had clients come to me in a world of hurt, in a world of trouble, because, oh, this is something my biller handles, or this is the front desk takes care of these things. I didn't know. They are not forgiving, okay? And you can really put yourself behind the 8 ball if you don't get out ahead of things and get a process in place. They don't care who you think should be responsible for telling you these things. If you're the provider, this is your provider ID number, this is your organization that you're in charge of, they're looking to you and you will suffer the consequences. So really, it's important, get yourself a system in place and don't leave it to others. Go ahead, Deb. Let's talk about assessing what comes in.
Okay, let me just add, Rob, just to what you said. I am currently dealing with a situation for a client who is facing a 6-figure repayment obligation simply because he never knew that the record requests came in. They didn't even, so the audit, the demand is not even based on the merits. It's like, we requested the audit, we requested the records, you didn't supply them, we want $500,000 back. So this is real. And we're fighting. If this happens to you, I don't want everybody to throw up their hands and say there's nothing we can do, but it just puts us way behind the 8 ball.
Yeah, can you fight it and get around it? You can, but boy, do you not want to be in that position? And if you can't, you're stuck.
Right. So let's get back to what the audit looks like. The most important thing that you need to know is who are you dealing with? Are you dealing with the government, Medicare, Medicaid fee-for-service, or are you dealing with a commercial payer? With a commercial payer, that will also include Medicare Advantage plans and Medicaid managed care plans. We want to know who we're dealing with because there's a heightened scrutiny when you're dealing with the government. Typically with a commercial payer, you're going to be able to resolve this, or we're going to be able to help you resolve it with money, not necessarily with the government. And those are the parade of horribles that we want to avoid when we're dealing with governmental audits. What's the audit period that we're looking at? If we think that the audit goes beyond, let's say, certain contractual limitations or statutory look-back limitations, Rob and I have discussed this, don't fight it on sending in the records. Unless it's really, really cumbersome and they're asking for hundreds of records. In that case, we can reach out initially and say, hey, wait a second, payer, you're asking for too many records. Can we narrow this scope down? We'll send you 50 records, and if they're clean, then we're done. If you need more records, we'll do it afterwards. And payers actually are pretty amenable to that. They're really not looking to make their lives so burdensome with looking at hundreds of records if it's unnecessary. Again, what's the time frame of the audit? And with respect to governmental audits, often auditors, or it used to be pre-COVID, auditors, would want to be on site. Will there be entrance and exit interviews? And of course, know your deadlines.
Right. Just one thing on who's conducting the audit. Be aware with so many managed care plans and Medicare Advantage plans, they have also, special investigation units where they are going to be looking for fraud and make referrals out if they're finding things. So it's really important to be aware, even when you have that overlay with the managed and advantage plans.
Agreed. Moving on to assessing the nitty gritty, make sure you calendar all deadlines.
Yep.
When did you get the letter? Often also check the date of the letter as opposed to the date you received it. You'd be surprised at how many times they could be a month apart, right? Somebody did a kind of a standard letter with a date, didn't change the date, and now you're already late by the time you get the letter. So you need to document date of the letter, when you receive the letter, the timeframes you have to respond to the letter. Do you need more time to respond? It's okay to reach out to the payer and say, hey, I'd like an extension in order to get you the records. I don't think I've ever had that a reasonable request,
Yeah.
turned down. And take a look, let's find out what the appeal process is. Is it one level, two levels? Where do we go? Is there protections in your contract if you are participating with the plan? Let's just make sure we know the playing field, as we get started.
Right. And that's why it's so important to have the process in place when it comes in, because your clock starts running when you receive the letter.
Right.
So let's talk about taking a look at what you're being asked for and what to do, Deb.
Okay. You're going to take a look at the request, right? You're going to say, this is important from a HIPAA perspective. Is the requester authorized to receive this information? And that has to do with, are they, if it's a third party, the health plans are authorized, right? We know that they are covered entities. They're
Right.
entitled to get this information. It's their members that they're seeking the information for. But if they're using a third party, typically in the letters that you're going to get, they're going to say, hey, we're Cotiviti. We've been authorized by Humana to request these records.
Right.
That's fine. And you can rely on that.
Yeah, and on the
But
government side, you'll see Safeguard is typically the UPIC who's been out there working with CMS.
What you can't do though, if you're not sure, right? If it's vague, or you've got something like, wait, this doesn't feel right to me, or it's a vendor that you've never heard of before, don't provide the requested information, but do respond. Dear third party, please provide us with evidence that you're authorized by a particular payer to receive this information. You want to go on record so that if it turns out that you never responded and we're stuck in the situation like I talked about, a few minutes ago, where we have a payer's offsetting $500,000 because we didn't respond, you want to show that you did respond. This is, HIPAA kind of trumps. We never want protected health information going out if we're not sure that the parties receiving it is authorized to get those records.
Yep. And now just being aware of those time issues, those statute of limitations,
Sure.
you run
So
into those issues too, right?
Absolutely. But here's a part that never makes clients very happy, but it is what it is. There are different timeframes. In your participating provider agreement, it may say that you have shortened the statute of limitations, let's say. So in a governmental audit, Medicaid can come back 6 years, and same for Medicare, or maybe it's 7 for Medicare fee for service. However, when you move on to managed care, Medicare Advantage plans can come back 10 years to look back. Fraud also can open up any type of contractual limitations and allow a plan to come in and request records going back 6 years. what's disappointing and stressful for clients is, let's say during your contract negotiations, you have a Medicaid managed care plan that has agreed to only look back 2 years, which is the standard in New York for fully regulated plans, but it doesn't apply to Medicaid. So it doesn't matter if you have a 2-year look back period in your contract if we're dealing with a Medicaid managed care plan. And we have fought this issue multiple times and there's no getting around it. So if it's a Medicaid managed care audit and they're looking back 6 years, that's permitted. These managed care plans have a fiduciary duty to the Department of Health, really to our tax dollars. So we're stuck with that 6 years, and Medicare Advantage is 10 years. So we have to be really, really careful about doing the right thing, because if you don't, the payback period could be pretty difficult.
Yeah, but it's important to know them because you can get into negotiations, particularly on the commercial, if they're overreaching. So it's an important thing to pay attention to, that we see, Deb and I see all the time. You know, you see overreaching and claims outside the periods of the 2-year period on the commercial stuff too. So
Right. So
it's
let me
important.
just get, Rob, I just want to add a little bit of clarity, because the 2-year is New York. That's 24
Yeah,
months on the commercial look back period.
right.
New Jersey is actually 18 months. And believe it or not, Connecticut is 5 years. So know your jurisdiction,
Right.
know what type of claims that they're looking for, and proceed from there.
All right. I think we've talked a lot and don't want to ignore Simon. So Simon, why don't you walk us through the components? It's important when you're grabbing the medical record, the legal medical record. Well, what are you supposed to be putting together? So why don't you walk us through that?
Yeah, so the primary purpose of the medical record is to tell the story by creating an illustrated timeline of the patient's health journey. So again, insurance carriers are not in your OR, so your documentation is critical to show from the consultation note why the patient was there, all the way through the diagnosis, the treatments, the follow-ups. So each entry of the medical record paints a clear picture of the patient's condition, the decisions that your physicians made, and the outcomes that were achieved. So the patient's medical record must contain the consent forms, history and physicals, the operative report, immediate post-op notes, nursing triages, physician records, medication discharges, and stuff like that. Additionally, the medical record plays a vital role in the billing process, ensuring services are accurately coded and reimbursed. So once again, be sure to gather as much of the medical record and ensure that it is signed and timely completed to ensure full compliance with the legal medical record.
What about signatures and note locking? Oops, sorry.
Yeah, so signature is a big component, as well as the date and time. Oftentimes we see signatures missing. So in the event that a signature is missing, be sure to reach out to legal and a medical auditor to review payer policies to see if a signature attestation would be allowed. Many cases, insurance carriers do allow signature attestations. But again, do not alter the notes, do not change anything, do not add any signatures after you receive the audit letter. Make sure you consult with legal and auditor regarding missing signatures.
Yeah, and this brings me to my point on this. Don't mess with your records. I have been with clients who have created bigger issues, criminal issues, because they have gone in and been worried and added information to the medical record, deleted, corrected something. They noticed something was an error. They carried something over that shouldn't have been there. I have had to walk into U.S. attorney's offices, New York Attorney General's offices, and try to explain things to try to mitigate the potential criminal, prosecutions because clients have engaged in this behavior. So do not fix anything. What's done is done. You will only put yourself in harm's way and create a bigger issue for yourself. So Deb, how about we get to, there comes the point where we have to submit these records.
Absolutely. So when you produce the records, look beyond, well, let me start. Look what they're requesting. Make sure you respond to what is being requested, but no more. If they're asking for information that you may keep, that may be kept separately outside of the traditional patient medical record, it's still part of the medical record, even though you might have a separate file for lab reports or something like that. So make sure you respond completely and accurately, that you keep a duplicate set of the paper of the record that you're being submitted. You can keep it electronically, but it's not enough to say, well, we have it all electronically anyway, we'll just pull it again if we need to. No, we've had situations where we've had every other page show up or something, and it's good for us to be able to say, oops, there was an issue with the submission. Particularly, we've had when you're pulling records off a medical electronic medical record system, make sure that what you're seeing when you're pulling them and putting them into a separate file, that it's clear that the signature page is showing up. We've had that situation where it got cut off. So again, the medical records were completely useless because they weren't signed, and therefore the plan said, yeah, we're not giving you any credit for these records. So that's an issue. Make sure you check to see what it looks like when the payer is going to receive it. Have a cover letter, making sure that you put the date, the project number, whatever identifying information that you need. Make sure it's going to the right party. Sometimes it doesn't go to the person who sent you the letter. There's a separate section in the request form that says all records should be submitted to X. Make sure you send the record securely and that you have proof of receipt. So these are, this sounds pretty basic, but you'd be surprised at how many issues arise from faulty submissions.
Yeah, how many times clients said, I need help defending this. What did yes, what did you send them? Can I have it? I'm not sure. And so it makes it a little tricky. Let's talk a little bit about issue spotting. Okay, so you've submitted the records, or simultaneous, pathway, or parallel path. You're going to take a look and see, what is it that this auditor may be looking at? What type of issues might I have? There's a proactive is getting out ahead of it, and there's degrees of being proactive versus waiting and see. There's a lot of different considerations, and there's not always a right answer. So sometimes, what are those considerations? Well, who's auditing you? Is it indicate fraud and abuse in the letter? Is that why they're auditing you? Is it a small sample of claims only, and maybe a low dollar amount? Is there any indication that the sample is going to result in an extrapolation? So those are kind of the factors you weigh, or maybe you come to us and you say, this is what's been keeping me up at night. I really want to get out ahead of it. And there's certainly benefits to it, but there's also smaller. You can also take a smaller look. So Simon, we interact so often on this and with varying degrees. So why don't you give them an idea of how does GHA approach the record review, and what kind of would a client be getting out of that?
Yeah, so prior to submitting any medical records to the insurance carrier, we recommend obtaining a healthcare consultant to perform a small proactive sample of your medical records. This will allow you to take and gain one step ahead of the audit gate and identify any possible concerns or potential issues that may arise from your medical record. These are typically 10 encounters, and we do them under Covell, where our trained auditors like myself look at the entire medical record to spot any deficiencies. Additionally, the audit will not only provide you the possible deficiencies that you might have with the medical record content, but will also assist the attorneys in preparing their responses. So it is critical to consider payer guidelines, such as those of CMS, commercial payers, and thoroughly understand whether the issues related to documentation issues or to coding and billing issues. So this will help potentially identify the issues and stop any bleeding and get you ready to submit those records.
Right. And so when you're saying what are the common, we're spotting issues for the ASC for our folks here joining, what are the common ASC issues that arise in your audits?
So there are many different issues that we see. The most common issues we see is missing signatures. Missing signatures should be an easy way to prevent by generating internal reports and keeping track internally to prevent that from happening. The other issue is incomplete documentation, particularly the operative report. So the operative report must be thoroughly and accurately documenting on what happens in the OR. This including the patient's name, date of service, the facility, surgical components, the procedure from start to finish, and a summary of findings. Remember, the operative report serves as proof of the services that were provided, and it is necessary for reimbursement for the facility, surgical team, surgeons, and is part of your legal medical record. The other component that we often see missing or incomplete is the informed consents. The informed consent should cover both the surgery and the anesthesia and be signed by the patient and the provider prior to rendering any services. And that's a lot of times once we receive the documents for review, we see the informed consents in there, but they're not signed. So be sure to have a proactive workflow to ensure the front end is signing them off. Physicians are signing off on operative reports, and documentation is complete.
Okay, so what if we find issues, right? What if your records are poorly documented? Your services billed weren't separately payable from your primary procedure. We have upcoding or some new problematic issues that maybe these auditors aren't going to even find. All of these things are possibilities. Well, you can't change the past. And so why being proactive is important is, stopping the bleeding, right? So is starting to put yourself and leveraging your position as best as you can. So if that knock comes at the door asking for money back, or taking some other action, you're in the best possible position to defend. And so what does that mean? That means we're putting up our hand and saying, yeah, we've got this. We saw it before you came to us. We've corrected it. We've adopted corrective action procedures. We've prepared different policies. We've retrained staff. We're doing a review of our billing, or we decided we're repaying something separately on our own. Those types of things are so important when you're trying to negotiate a settlement. It shows really good faith, and it shows that you really are a provider who wants to be, a good partner for either whatever plan it may be. So really important stuff.
So Rob, just to reiterate, we don't want clients putting their heads in the sand. All right,
Exactly.
you've taken a look, you say, this doesn't look so good. I don't really think that I've, documented medical necessity as appropriately as I should have. Or yeah, the code that I built probably was a level 3, not a level 4, etc. So we want you to be realistic. It's not always one size fits all, but you need to get the right help. Do I reach out to legal counsel? Do I want to get an independent auditor to come in and take a look and say, well, I'm not really sure what I'm looking at. It looks okay to me, but I don't want to be blindsided when a demand letter comes in. Is there a fear that there's going to be extrapolation and there's going to be, we're going to need a statistician? So you just really want to assess what you're seeing and what needs to be done, again, to prepare yourself for a defense, also to get that leverage when you're negotiating perhaps a settlement. Because as Rob said, yeah, we fixed it before you guys even found it, which does really go a very long way. If you're dealing in Medicare and Medicaid, and Rob, I'll let you, chime in on this in more detail, but you may have to do a self-disclosure. So you want to be clear that you've done what you're supposed to do, especially you put in place, let's say, a compliance program that's necessary.
Yeah, all of those tools are important. Is it we're going to implement a compliance program? Is it we have an existing compliance program that we're strengthening with perhaps some additional audit functions into our compliance work plan? Or are we looking at this and saying we have a problem that's bigger than the audit period and we're going to prepare our own disclosure? Those are all things that you're able to get out ahead of, and start trying to limit your liability as best as you can.
And then one day you get the audit results, right?
Yeah,
And
what
it's
everyone
that,
dreads.
yeah, and it's that lovely letter that says, dear provider, we thank you for your medical records. We've reviewed them. And now please send us a check for $1 million. And we've actually seen letters just like that. Again, you go back to the beginning. What's the date of the letter? How much time do you have to respond? Is there another level of appeal? When you read the letter, did you determine, oh, wait a second, we forgot to send in a whole bunch of records that we have. This is
Yeah.
the start where you start to say, all right, how do we address this?
Yeah,
What are our appeal rights?
yeah.
So it's
And as you're doing that, start formulating that response, right?
absolutely.
Don't delay.
And here's the part where, we talked a little bit about when do you call counsel? It really depends on who you are in your comfort zone, the ability, the staff that you have on site to respond. Is it really just sending in more records? Maybe you reach out to counsel and say, hey, look, this is where we're at. We're going to take it at this point, and then we want you to step in for the second level of appeal. Lots of ways to go about this. But I sometimes, make that call to counsel, decide with counsel, what's the best way to respond? Is the amount of money such that it may be cheaper to do a quick settlement? If you can, and not have the additional expense, any type of settlement, you want to make sure that you are never acknowledging any wrongdoing whatsoever. The settlement is self-contained, it's confidential. You don't want to do those on your own. That's a legal document. You really should have them reviewed by counsel. But I just had a situation where we agreed on a settlement. It was a third party sends over this letter. I don't even want to say it was nonsense. It wasn't a release for my client. It was nothing. And I had to spend a bit of time making sure that our client was protected when they paid over the money, because we don't want the plan to come back and say, oh yeah, by the way, that time period we were looking at, it's really not closed out. We found something else. We don't want that, right? If you're being audited, and I'm very blunt with the health plans. My client can't keep going through this. It's too expensive, it's too time consuming, and it's too stressful. So if you've got issues, let's deal with them now, but we're taking care of as much as we can in this particular audit and settling out time periods to the extent that we can.
Yeah, I agree, Deb. And there are varying strategies. We come across it all the time. Sometimes it's just more expensive to defend it, but you need to work out that settlement. But if you are going to be in that position where you really want to review it, because you don't want to assume these findings are correct, you really do want to file your appeals, because you don't want them, the potential to keep coming back. And you'll decide, is it going to be litigating or negotiating? That'll get dictated about what happening. But Simon, you talked a little bit earlier about kind of taking a look at that, smaller sample. But like, if we were going to put together the appeal, we do this all the time, but why don't you explain what are you doing at that point?
Yeah, many times when GHA gets involved in reviewing the medical record documentation, we look at the deficiencies provided by the payer and perform our independent review of the medical records to see if we agree with the payers. So I always say, don't assume just because the healthcare payer found the deficiencies that there won't be opportunities to appeal it. It is always important to review the audit report findings and compare them against their policies, their procedures, and your medical record content. Like we said before, have an independent auditor review a small sample of the documentation to see if they agree with the findings. When GHA does a review of the audit findings, we examine the medical record and apply all applicable coding and billing guidelines to determine if the audit findings are accurate. This may involve reviewing additional documentation that is beyond your operative report to justify the services rendered. So based on our review, we develop a comprehensive audit report where we either appeal the findings with supported information from anywhere we find in the medical record and included with the payer policies, or we do agree from a documentation and coding standpoint with the audit findings and implement a corrective action plan to prevent the bleeding. This may include documentation revisions, template revisions, education and training, correct coding guidelines, and so on. So don't be afraid to implement a corrective action plan based on the audit findings. It is better to correct them than to continue bleeding.
Yeah, in my experience, what we do is we usually make sure we have from the auditor there. It's typically a spreadsheet where they have all the claims data and the particular audited claim line, the finding per claim line, and we'll have GHA create a new column and rebut things there. We'll also have a supplemental submission from counsel raising various legal arguments. So you want to make sure you're getting everything from your auditor in order to fight them, including stuff regarding information and data regarding how they conducted an extrapolation, if that's involved. So then we come, to a resolution. And so you really want to try to get the most appropriate settlement and using the most effective strategy. And it can be any of these things, from hearings and litigation down to settlement, offering to enter into compliance agreements. What you really want to work to also prevent, in my case, is a snowball effect where you're dealing with, if it's a targeted, audit and education by Safeguard Services on behalf of CMS, whether for Medicare or for Medicaid. Audits, you really want to avoid repeats, coming back, having the same problems over and over again, because you're going to end up facing Medicare revocation and termination, preclusion lists. Other payers try to now also, I've seen recently, if they're not really happy and they think, they're not getting their fair share, they're referring things over to medical boards too. That's really in the commercial setting. So you really want to try to work for the most effective and most appropriate resolution that you can.
Absolutely. And
But
Rob, we
yeah,
probably
go
should have
ahead.
mentioned this a little earlier, but we often get the question, I'm out of network, so do I even have to
Right.
bother with the either responding to the medical record request, or you send in the records and they send in a demand to repayment. It's like, hey, I'm out of network, forget it. I'm going to ignore this demand. And Rob, in a word, what's our advice when it comes to
Produce
being
the
out
right.
of
If you're getting the
network?
money, give them the records. Okay, you can fight with them afterwards, and try to reach, a resolution unless there's some reasons not to. But I'll tell you, I'm dealing with one of those out of network issues right now, and I know it's them. I know it's the payer that referred my client to the medical board because I'm getting investigated now, on the same issues that they're raising their audit on. And it's a ridiculous tactic, but it's what we have to deal with. So I can tell you my client doesn't want to be doing that. So as much as you can mitigate there, the better I generally find it is for the client.
And I agree. I mean, I had a situation once where an out-of-network provider just never sent the medical records. 2 years later, took that long for the plan to catch up, but they stopped paying that provider's claims.
Right.
So it took a while for us to even figure out what the problem was. And we ended up actually having to go back and providing the medical records that they requested 2 years ago, but at least we were able to turn this spigot back on for current claims. And it turned out his claims were fine. But the plans, it's I tell clients all the time, it's their bat, it's their ball, it's their rules. So we are at a bit of a disadvantage. And the regulators really don't step in on these types of issues. They look at it as a contractual or quasi-contractual relationship. So, we
Yeah. How
do
many
fight
times
the
have
good
you,
fight.
yeah, how many times have you heard, like, and even the client's perspective, like, this is my biggest source of revenue. I really don't want to, end up in a position where my contract's getting terminated. So, I mean, there's all kinds of considerations and leverage that, weigh into your decision on how how you're going to fight it. I mean, I prefer to fight and fight, you know, for as long as it makes sense,
Right.
and it's in the client's interest.
Also, you know, Rob, the two of us handled a particular audit where the client had a tremendous tolerance for fighting the fight. There were
Yeah.
issues, we had real concerns, but they were like, they were okay. We've had
Yep.
other clients who were like, how fast can you make this go away? I'm not
Yep.
sleeping at night.
Yeah.
So that's
Yep.
often a major factor in what we recommend. Again, sometimes it's the amount of dollars involved of the repayment, but the flip side, I've had clients say, I don't care if it's a penny, I did everything right, and we're
Yeah.
gonna fight it. And
Yeah.
we do.
Yeah. And there's all kinds of ways, different types of experts, medical experts, you know, coding experts, statistical experts that we retain to try to, blow their statistical sampling out of the water. Because if you end that, you know, you end most of the audit. But I know what everybody really wants to know is how do I not have to deal with this? And how can I prevent, audits, or at least how do I prevent the negative outcomes? We can't, because we're all going to get tagged at some point with an audit. The question is, how can I put myself in the best position so that I get one day that audit letter comes? So, Simon, what are things you see from, as a certified coder that you recommend to clients when they come to you? Because we have plenty of clients who come for the prophylactic advice. Hey, I want to just make sure my shop is clean.
Yeah, so after any audit or just in general, there are always lessons to be learned and corrective action plans to implement. It is important to be proactive in identifying documentation issues before your next audit. These steps could be done both internally and externally through a healthcare consultant to help with your initiatives. So to spot issues internally, conduct regular internal audits. Conducting routine audits of your medical records will ensure compliance with regulatory standards and organizational policies. Are your providers meeting the benchmark? How many problematic providers do you have? Are you auditing more frequently those problematic providers? How can it be done? Well, develop checklists, use your systems to help you. It could be done based on coding accuracy, based on documentation completion, timeliness. So create a systematic approach to reviewing internally all your medical records. It is always important to focus on those high-risk areas, such as coding and billing, operative reports, and consent forms. The next is leveraging your EHR systems. Everyone now has a sophisticated electronic health record. Utilize it, use the analytic tools to help identify any patterns and trends that could be issues with the documentation. We recommend using dashboards and reports to monitor metrics such as missing documentation, inconsistent data entries, unbilled procedures. When you're doing coding and billing, use those NCCI edits, use those scrubbers, and make sure you submit claims clean claims out the door. On the external side, for example, GHA, we get involved in performing unbiased external audits. What is common for you might not be common for an external audit. So as an external audit, we look at all the issues to provide areas of improvement, spot any issues, and the most important one is develop a corrective action plan. These internal audits are typically done on an annual basis. And again, it's about 10 encounters per provider where we review coding and billing, compliance with industry standards such as CMS, AMA, the correct coding initiatives, edits, and so on. And we reviewed the accuracy and completion of medical records. Based on these audits, we can provide training and education and help you understand what the issues are and how to correct them moving forward.
Yeah, for me on this one is this, maintaining an effective compliance program. And What I don't mean is you have a compliance program in paper only. It's an effective compliance program means you have a work plan, you're developing, ensuring your training and education is getting done. You're ensuring that you're staying on top of, hot issues, and that more importantly, you're developing internal auditing going on throughout the year in order to identify potential issues and resolve them quickly. So I think that's those are the ways that you can really, give yourself that ounce of prevention is always going to be less expensive, and really save you a lot of time, money, and, headaches and stress later on. So, Deb, do you have anything else you want to add here as we thank everyone for joining us today on this important topic?
I think you guys did a great job covering it. I would just add, when it comes to the commercial payers, make sure you know their specific guidelines. It's
Yeah.
worth the time to keep up on their websites. What are they suddenly saying that they're no longer covering, or what are they bundling together? To the extent you can, there should be providing you with notices. They're usually provider notices or newsletters. Read those. It's important to know what's changing with the payers. With that, we thank you all for joining us. Again, we'll be live at 3:30. Type in your questions. You can email us. We have our contact information, as you see, at the end of the slide deck, and the slide deck will be made available to you at the end of the webinar. So enjoy the rest of the day, and we look forward to hearing from you later.
Thank you.